Hey, this is Mason Haley with Wahpeton Family Dentistry. Our goal is to take the fear out of dentistry and help patients make informed decisions about their oral health. Today we're talking about something that sounds simple, but makes a huge difference: proper brushing technique. Now I know what some of you are thinking. Dr. Mason, I've been brushing my teeth since I was in footy pajamas. I think I have it figured out. Fair point. But here's the funny thing. Most people brush every day, but many people are still missing the small details that matter. It's kind of like mowing your lawn. You can own a mower, start it, and walk around the yard. But if you miss the corners, scalp the grass, and run over the flower bed, the results may not be what you hope for. Brushing is not just about fresh breath. It's about removing plaque. Plaque is a soft, sticky film that builds up on your teeth every day. It has bacteria in it. Those bacteria eat sugars and carbs from the food and drinks that you consume. Then they make acid. That acid can weaken enamel and lead to cavities. Plaque near your gums can also make your gums red, swollen, and likely to bleed. So brushing is really a daily cleanup job. You're not trying to sand the teeth. You're trying to gently remove the sticky film before it causes problems. Let's start with the basic rule that everybody knows. 2 minutes, 2 times a day. Morning and night is the easiest routine for most people. The nighttime brushing is especially important. If you go to bed with plaque and food stuck on your teeth, it gets to sit there for hours. That is like the bacteria on the night shift and telling them, "Great job, team. Keep working while I sleep." A lot of people think they brush for 2 minutes, but when they time themselves, it's often more like 35 seconds. 35 seconds is enough time to start brushing, think about tomorrow's schedule, and walk away with toothpaste still on your chin. It's not enough time to clean every surface well. Here's a simple way to think about 2 minutes. Dive into your mouth in 4 parts: upper right, upper left, lower right, lower left. Spend about 30 seconds in each area. That gives each section a fair chance. If you have an electric toothbrush with a timer, that's great. If not, a phone timer, a song, counting slowly. Just maybe don't pick a 9-minute power ballet unless you really love brushing. Next, let's talk about the brush. In most cases, a soft-bristled toothbrush. Soft does not mean weak. Soft bristles can clean well without beating up your gums or enamel. Medium or hard bristles may feel like they're doing more, but they can be too rough. Think of it this way. If you had mud on your car, you would not clean it with a wire brush. You'd use the right tool and gentle pressure. The toothbrush should fit your mouth. If the brush head is too big, it may not reach all the way to the back teeth. Smaller brush heads often make it easier to reach around the molars and along the gum line. Now for the big technique point. Angle the brush toward the gum line. A good goal is about 45-degree angle. That means the bristles point partially toward the teeth and partially toward the gum. Why? Because the gum line is where plaque loves to hide. It is like the baseboard of your mouth. If you clean the middle of the wall, but not the baseboard, dust builds up. Same idea. Use small, gentle strokes. Tiny back and forth motions are better than big scrubbing motions. You do not need to brush like you're trying to remove old paint from your deck. Gentle wins. If your toothbrush bristles look smashed after a few weeks, you're probably brushing too hard. Your teeth are not dirty pans. They do not need elbow grease. Brush the outside surfaces first, if that helps you remember. That means the cheek side of the teeth. Keep the brush at the gum line. Move slowly, tooth by tooth. Then brush the inside surfaces, the tongue side of the teeth. These are easy to rush because nobody sees them in the selfie. But plaque doesn't care about camera angles. It grows where it grows. For the inside of the front teeth, turn the brush upside down. Use the tip of the brush and make small up and down strokes. This is one of the most commonly missed areas, especially behind the lower front teeth. That area can collect tartar quickly because saliva glands are nearby. If you ever had a cleaning and felt a lot of scraping behind your lower front teeth, this is probably why. Then brush the chewing surfaces. These are the tops of the teeth where the grooves are. Use short strokes and make sure you reach the very back. The last molars are like the back row of a movie theater. They're easy to forget. They're still there. Do not forget about the gum lines along crowns, bridges, implants, and fillings. Dental work still needs care. A crown cannot get a cavity on the crown material itself, but the tooth edge under or around it is still at risk. Implants also need to be careful cleaning around the gums. Dental work is not a free pass. It is more like owning a nice vehicle. You still have to wash it, maintain it, and try not to get run into by another vehicle. Let's talk about pressure. Many people brush too hard, but brushing too hard can irritate the gums and may contribute to gum recession or to tooth sensitivity over time. A good test is this. Hold your toothbrush with just your fingertips instead of a full fist. That naturally lowers the pressure. If you're using an electric brush, let the brush do the work. You guide it. You do not need to scrub with it. Electric toothbrushes can be very helpful, especially for people who tend to rush or have trouble with hand movement. But a manual toothbrush can also work well if the technique is good. The best toothbrush is the one that you use correctly and consistently. Fancy new electric brush sitting dead in a drawer is not better than a simple manual brush used twice a day. That drawer does not have plaque. Your teeth do. Now, what about toothpaste? Use a fluoride toothpaste unless your dentist gives you other instructions. Fluoride helps strengthen enamel and lower cavity risk. For most adults, a pea-sized amount is enough. You do not have to get a giant ribbon of toothpaste like commercials do. Commercials also show people waking up with perfect hair. So we have to be careful where we get our life advice from. After brushing, spit out the extra toothpaste. Try not to rinse aggressively with a big mouthful of water right away. When you rinse a lot, you wash away some of the fluoride that could stay on the tooth and keep helping. A simple spit is usually better. If you hate the toothpaste taste, talk with your dental team about a flavor or product that works better for you. What about your tongue? Brushing your tongue can help with bad breath because bacteria can sit on your tongue surface. You can gently brush your tongue with a tongue scraper. Do not go too far back. Start wrestling match with your gag reflex. This should be helpful, not a survival event. Now let's cover some common mistakes. Mistakes number 1, brushing too fast. If you only brush the teeth that show when you smile, you're cleaning the lobby and ignoring the rest of the building. Mistake number 2, brushing too hard. Gums like gentle care. They do not like being attacked twice a day. Mistake number 3, using an old toothbrush. Replace your toothbrush or electric brush about every 3 months, or sooner if the bristles are frayed. If the toothbrush looks like it was used to clean the grill, it's time to retire it. Mistake number 4, missing the gum line. The gum line is where a lot of action happens. Angle the brush there and slow down. Mistake number 5, brushing right after something very acidic. If you have a soda, sports drink, or energy drinks, or citrus, it may be wise to rinse with water and wait a bit before brushing. Acid can soften enamel for a short time. Brushing right away may be abrasive. Water is your friend here. Mistake number 6, thinking brushing replaces flossing. It does not. A toothbrush cannot fully clean between the teeth where the teeth touch. That is like washing only the outside of a cusp and never cleaning the inside. Clean between your teeth once a day with floss picks, or interdental brushes, or a water flosser that works for you. Correction, that should be twice a day. Parents, let's talk about your kids for a minute. Kids often need longer than we think. A good rule is that a child cannot tie their shoes. Well, they probably do not have the hand-eye coordination to brush perfectly on their own. Let them practice, but an adult should help or check. For young kids, use the right amount of toothpaste. Children under 3 need only a tiny smear, about the size of a grain of rice. Kids 3 and older usually use a pea-sized amount. They should spit out the extra toothpaste. For people with braces, brushing takes more time. Brackets and wires create extra hiding spots for plaque and food. Brush above and below the brackets, along the gum line, and around each tooth. A small proxy brush can help clean under the wires. If you have braces and you finish brushing in 30 seconds, there's a good chance the braces are still holding yesterday's snack hostage. For people with dry mouth, brushing is also very important. Saliva helps protect the teeth. When the mouth is dry, cavities can happen faster. Fluoride toothpaste, water, and regular dental visits matter even more. Some people may benefit from prescription fluoride toothpaste, but that is something you want to discuss with your dentist. Here's a simple routine you can remember. First, use a soft-bristled brush and fluoride toothpaste. Second, angle the bristles toward the gum line. Third, use gentle small strokes. Fourth, clean every surface, outside, inside, chewing surfaces, and behind the front teeth. Fifth, brush for 2 full minutes twice a day. Sixth, replace your brush when it gets worn. If you want to make this even easier, do the same routine every time. For example, start on the upper right outside, move around to the upper left, then the lower left, then the lower right. Then do the insides in the same order. Then chewing surfaces. Having a pattern keeps you from missing areas. It's like a pilot checklist, but with more mint flavor. One more thing, bleeding gums are not a sign to stop brushing. They're usually a sign that the gums are irritated, often from plaque. Gentle brushing at the gum line, cleaning between the teeth usually helps. If bleeding continues, your dental team should take a look. Do not ignore bleeding gums, but do not punish them either. Gentle and consistent is the key. So why does proper brushing technique matter? Because small daily habits add up. 2 minutes twice a day can help you lower the risk for cavities, gum problems, bad breath, and expensive dental treatment. It is not glamorous. Nobody is making a superhero movie called Captain Toothbrush. But if they did, I would watch it, and honestly, the toothbrush would probably win the final battle against the plaque. At Wahpeton Family Dentistry, we want patients to feel confident, not embarrassed. If you're not sure you're brushing the right way, ask us. We can show you in our office. That's part of our job, no judgment. We would rather teach small fixes now than have to address bigger problems later. Our takeaway is brush gently, aim at the gum line, take your time, and be consistent. Your teeth do not need a power wash. They need a careful daily cleanup. This is Dr. Mason Haley with Wahpeton Family Dentistry. Thanks for listening, and remember, we are here to take the fear out of dentistry and help you make informed decisions about your oral health.